Namaste guys, and welcome back to Brain Talk. This is your host and friend Dr. D. Shobraj, and why I'm here today after so long. I know it's been weeks, I know I haven't posted. I want to make you aware that there's a new COVID variant that's out there and people are dying. It was diagnosed in Hong Kong, and I think it was 21 something cases. And there's a lot more info in the video today about that. So stay tuned, and there's more stuff coming, and I really apologize for being late. I am not getting time with the patients. Whenever I get time, I post a video. Let's watch this one.
Just when we thought the worst of the COVID-19 pandemic was behind us, a stark reminder emerges. The vibrant cities of Hong Kong and Singapore are grappling with a new wave of infections, shattering any illusions of a swift return to normalcy. This resurgence, characterized by a surge in cases, underscores the persistent threat of the virus and the importance of continued vigilance. This is not a drill, it's a call to action. The numbers are alarming, painting a picture of a virus that refuses to be ignored. The familiar anxieties of mask mandates, social distancing, and the looming fear of lockdowns are resurfacing, reminding us of the fragility of our hard-won progress. This resurgence is a stark reminder that the virus is still circulating, and its ability to mutate and spread remains a potent threat. The fight against COVID-19 is far from over. We must remain vigilant and prepared to adapt to the evolving nature of this global health challenge. This is not just a regional issue, it's a global concern. The interconnectedness of our world means that a surge in one part of the world can quickly escalate into a global crisis. The new wave in Hong Kong and Singapore serves as a wake-up call for the global community. The statistics paint a sobering picture. Hong Kong, once lauded for its successful containment strategies, is witnessing its highest positive test percentage in a year. The surge is not limited to mild cases either. There's been a concerning uptick in severe cases requiring hospitalization and, tragically, even deaths. Meanwhile, Singapore is facing its own battle. The Lion City reported a 28% jump in estimated cases in a single week, pushing the healthcare system to its limits. The strain on resources is evident, with hospitals reporting a 30% rise in COVID-19 related admissions. These numbers are not mere statistics. They represent real people grappling with the virus's debilitating effects. Each percentage point increase reflects individuals facing the uncertainty of illness, families grappling with the fear of losing loved ones, and healthcare workers bravely working on the front lines. The data underscores the urgency of the situation. This is not a time for complacency, it's a time for decisive action. We must heed the warnings embedded within these statistics and act swiftly to mitigate the impact of this new wave. This resurgence challenges our previous understanding of COVID-19's seasonality. The conventional wisdom was that respiratory viruses like the flu are more prevalent during colder months. Yet this surge is happening as the mercury rises, defying expectations and raising questions about the virus's evolving behavior. Experts suggest several factors might be contributing to this unusual summer surge. Waning immunity from previous infections and vaccinations is a key suspect. As time passes, the effectiveness of vaccines in preventing infection, especially mild ones, tends to decrease, making individuals more susceptible to the virus. Adding to the complexity, new variants are constantly emerging. While there's no evidence yet of a more dangerous variant driving this current surge, the possibility remains. The virus's ability to mutate and evade our immune defenses is a constant reminder of the need for ongoing surveillance and research. This summer surge underscores the unpredictable nature of this virus. It reminds us that we cannot afford to become complacent. Continued research, genomic surveillance, and public awareness campaigns are crucial to understanding and combating this evolving threat. This is not the first time Hong Kong and Singapore have faced the wrath of COVID-19. Both cities have weathered previous waves, each leaving its own mark on the collective memory. This current surge, while concerning, is a stark reminder of the resilience these nations have demonstrated in the face of adversity. In early 2022, Hong Kong experienced a devastating wave fueled by the Omicron variant. Hospitals were overwhelmed, and the city's healthcare system was pushed to the brink. The images of makeshift hospitals and exhausted healthcare workers remain etched in our minds. Singapore faced its own challenges with the Delta variant in 2023. The city, known for its strict control measures, implemented a circuit breaker lockdown to curb the spread. While disruptive, these measures ultimately proved effective in controlling the outbreak. These past experiences, while challenging, have equipped these nations with valuable lessons and strategies to navigate this new wave. The ability to adapt, innovate, and prioritize public health will be crucial in overcoming this latest challenge. The resurgence of COVID-19 is not just reflected in statistics, it's impacting real lives and events. The recent cancellation of renowned Hong Kong singer Eason Chan's concerts in Taiwan due to his COVID-19 infection serves as a stark reminder that the virus continues to disrupt normalcy. Chan, a beloved figure in the music industry, was forced to postpone his highly anticipated performances after testing positive. The news sent shockwaves through the entertainment world and disappointed countless fans eagerly awaiting his return to the stage. This incident underscores the virus's pervasive reach, impacting even the most high-profile individuals and events. It serves as a potent reminder that no one is immune to this global health threat, regardless of their social standing or profession. The cancellation of Chan's concerts is a microcosm of the broader disruptions the virus continues to inflict on our lives. It highlights the importance of remaining adaptable, prioritizing health and safety, and acknowledging the ongoing threat posed by COVID-19. Section 6. A wider lens, the regional ripple effect. The resurgence of COVID-19 in Hong Kong and Singapore is not an isolated incident. It's part of a broader regional trend that's causing concern among health officials. The virus respects no borders, and its resurgence in these two Asian hubs underscores the interconnectedness of global health. China, the world's most populous nation, is also grappling with a surge in cases. The test positivity rate has more than doubled in recent weeks, raising concerns of a potential wave that could rival the peak seen in the summer of 2024. Thailand, a popular tourist destination, has also reported cluster outbreaks in 2025, with cases spiking after the Songkran festival in April. The increase in travel and social gatherings during festive seasons can contribute to the spread of the virus, as seen in this instance. The interconnectedness of the region, through travel, trade, and cultural exchange, means that a surge in one country can quickly spill over into neighboring nations. This interconnectedness necessitates a coordinated regional response to effectively combat the virus. Section 7. The importance of vaccination and booster shots. Amidst these concerning developments, there's a beacon of hope: vaccination. Vaccines remain our most potent weapon against COVID-19. While they might not completely prevent infections, they significantly reduce the risk of severe illness, hospitalization, and death. Booster shots, in particular, play a crucial role in maintaining immunity, especially as the effectiveness of initial doses wanes over time. Studies have consistently shown that booster shots provide a significant boost to antibody levels, enhancing protection against emerging variants. Health authorities across the region are urging people to stay up to date on their vaccinations, including booster shots. This is particularly crucial for vulnerable populations, including the elderly, those with underlying health conditions, and frontline healthcare workers. Vaccination is not just an individual act, it's a collective responsibility. By getting vaccinated and boosted, we protect ourselves and contribute to herd immunity, safeguarding those who cannot be vaccinated and reducing the strain on healthcare systems. Section 8. Navigating the new wave, a call for vigilance. As we navigate this new wave of COVID-19, it's imperative to remain vigilant and adhere to public health measures. While the fatigue with restrictions is understandable, letting our guard down can have dire consequences. Simple measures such as wearing masks in crowded indoor settings, practicing good hand hygiene, and staying home when sick can significantly reduce the spread of the virus. These measures, though seemingly small, have a significant impact when adopted collectively. Testing also plays a crucial role in controlling the spread. Regular testing, even without symptoms, can help identify asymptomatic cases early on, preventing further transmission. Rapid antigen tests are now widely available and provide quick results, making regular testing more accessible. This is not the time for complacency. We must remain informed, follow the guidance of health authorities, and prioritize the health and well-being of ourselves and our communities. Section 9. A shared responsibility. The resurgence of COVID-19 in Hong Kong, Singapore, and the broader region serves as a stark reminder that this pandemic is far from over. It's a global challenge that demands a collective and coordinated response. This is not just the responsibility of governments or health authorities, it's a shared responsibility. Each individual has a role to play in mitigating the spread of the virus and protecting the most vulnerable among us. By prioritizing vaccination, adhering to public health measures, and staying informed, we can collectively navigate this new wave and work towards a future where COVID-19 no longer dictates our lives. The road ahead may be uncertain, but our resilience, coupled with scientific advancements and a commitment to public health, will guide us through this challenge. This is a time for unity, compassion, and a shared commitment to overcome this global health crisis.